Has a bachelor's degree from the State University of New York at Geneseo, master's from the State University of New York at Brockport with specialization in behavior modification and applied behavior analysis. He has a master's degree from Nova Southeastern University and a doctorate in psychology from Nova Southeastern University. Presently, he is the owner, president, and psychologist with 2 organizations. One is Psychological and Life Skills Associates, and the other is the Social Skills Center in Woodbridge. He authored a book entitled Peer Process Social Skills Groups, a treatment manual for mental health therapists, behavioral specialists, and school professionals. In my work, I have known him to be a clinician who has had success with remarkably reluctant clients. So he's going to talk with us about socialization and how to make it better. Right?
Thank you, Betsy. I appreciate it. Difficult patients. I've had 1 or 2 from you.
Yes. In fact, all the ones I've sent have been incredibly reluctant.
I'm glad to hear that I was helpful. That's fantastic. As Betsy said, I'm Dr. Christopher Haley. I'm a licensed clinical psychologist, and as she mentioned, I'm the owner of 2 separate practices, Psychological and Life Skills Associates, and my brand new practice, which is the Social Skills Center. I've actually had my new practice, I'll tell you about in a minute, but I've been practicing out of my Social Skills Center for the past 1.5 years. I consider myself a social skills specialist. There aren't that many out there. I've always been a huge believer that social skills are the most important skills in life, and I know I'm biased because that's what I do. But I'm a big believer that if you're a good communicator, if you are a good listener, I think listening skills are underappreciated. I think if you're exceptional at networking and connecting with people, I'm all about life's about relationships. I think you're going to be successful in life, and I think you can define success any way you want it. A lot of the kids I see, especially the boys, I want to be rich. Okay, you can define success that way. You can define success in my way, being a good dad, being a good partner, being a good owner and treating my associates and employees well, being a good person in life. But regardless of how you define success, I think if you possess good relationship skills and good social skills, I think you're going to be successful. And here's where parents cringe. I think social skills are more important than school grades. And most people here being from the Northern Virginia, we've got Spotsylvania and Northland apparently. A lot of parents put a lot of emphasis on school grades and getting the straight A's. I know people that have gotten straight A's in life, and probably you guys do too. People have gotten straight A's in life where they really struggle because they're not good with the communication skills and they're not good with the relationship skills. These are the same people that, if it's a birthday party of an employee at work, they won't go. They'll instead stay in, and if there's a happy hour, they'll sit there and people go and read a book. It's very difficult to work your way up the ranks in life if you do not possess really strong social skills. And you guys probably know people that are average students, maybe B's or C students that really excel in life because they possess these essential life skills. So that's what I'm all about. A little bit about my practices. I didn't know how to switch. Go to the next one. Oh.
Sarah, do you have a clicker?
I got it. I'm very good. I actually went to college from 1992 to 1994, right before computers became popular, so I'm a little bit computer illiterate myself. I can figure that one out pretty quickly. My main practice is Psychological and Life Skills Associates. I'm proud to say that we've been around 25 years. I actually got just this year, 2014, we celebrated our 25th anniversary. I joined Psychological and Life Skills back in 1999. I actually did my residency with my previous business partner who has since semi-retired. My main practice actually took the liberty of putting a... Is that coming in the computer?
Yeah. Might still be installing.
I'll give it a look.
Give it a second, and it should work.
Okay. I took the liberty of putting a staff list of psychological and life skills in everyone's packet. I have 12 associates that work with me there, and we are a very diverse practice with many different specialty areas. Again, my specialty area is mostly children and adolescents, but I have specialists that see older adults as well. In marital therapy, we do psychological testing. We have a very large neurofeedback and biofeedback program. I'm really proud of our practice. That we really have a great staff. We're located in Woodbridge and in Fredericksburg. Does anyone else need a handout, by the way? You guys in the back? we're located in Woodbridge and in Fredericksburg. And as I said, I joined the practice in 1999. Again, given my interest in social skills, when I joined the practice, I went right into teaching social skills groups. And my program from 1999 to 2013 became so large that right adjacent to our practice, I opened up my brand new social skills center, which is where I see all my patients out of nowadays. I currently facilitate 12 different groups every week. 9 of them are with children and adolescents. I actually do 3 adult groups now too. So I'm trying to expand into the adult population, very needed for adults as well. My interest in social skills actually began, it's a little bit of a sad story, it began back in the 70s when I was in elementary school, and I remember being maybe 6 or 7 years old, and I remember sitting at lunch and sitting with my friends and talking about whatever we were talking about. But where I went to elementary school, I actually grew up in the suburbs of Buffalo. These tables remind me of the lunch tables. Remember those long rectangular tables you used to sit at? So like we had a big group of kids over here. But I remember sitting at the table, talking to my friends, and looking all the way down at the end of the table. And there was one kid sitting there by himself. You know, I'll never forget it. And it was tough because when you're a little kid, you feel, but it was hard for me to do something about it then. But even as a kid, I remember just feeling a little bit ashamed and humiliation as empathy as to what that poor child was feeling. And the worst part about it really bothers me. The worst part about it is that no one did anything about it. Not the lunch lady, not the teacher, not the adult who was walking by and let that poor kid sit there. And after that experience, and multiple other experiences throughout my childhood and teen years and even adult years, I made a commitment to myself to do what it takes to not let that happen. And I know some kids prefer to sit by themselves, and spectrum disorder kids are overstimulated, prefer that. And I'm not talking about that. I'm talking about a child that wants to be in the movie, that wants to be in the mix, that's looking for acceptance, that isn't getting it. And so I really kind of, it's my passion, I made it my mission. I want to help as many children, adolescents, and now adults with these, I call them essential life skills. And today I'm going to talk about my social skills and how I help those that have a brain injury. It's a huge population that needs help with social skills. By the way, if you have any questions, comments, just jump right in, raise your hand. Feel free to interrupt me. Let's see if I can get this to work. All right. I'm a numbers guy because math never lies. How many Americans sustain, this has to do with incidents, the number of new cases, how many Americans sustain a TBI annually? What do y'all think? Jump on in, don't be shy. A, B, C, or D?
Reported or?
Yes, correct. Reported. Yes. C, got 140,000. Anyone? Not 1,400, right? Can't be that. No. Anyone? Anyone for D? D, 1.4 million. These are just reported cases. That's a big population. A lot of people sustain brain injury. And along with the traumatic brain injury, do a real quick comorbidity here. What goes along with that? For those that experience a TBI, what is the biggest diagnosis? Do you experience depression, substance abuse, anxiety disorders, psychotic disorder? Any thoughts on that one?
Depression.
Who said that? It's a trick question. All the above. All the above. So not only in addition to a mild, moderate, or severe TBI, you're at risk for all these different things. And because of that, this is what happens. What percentage of individuals with the TBI report difficulty making new friends? This is across the board for children, adolescents, and adults. No surprise, anyone? 75%. 3 out of 4 of those 1.4 million reported, just the reported younger. And so they need help. They need help. I wasn't quite sure who was going to be in attendance today. I wasn't sure if there would be more parents or more professionals. Clearly, well, when you guys were going around the room, I know it's more professionals. It was part of our responsibility, or at least part of my responsibility, is to certainly help. Is 75% of the 1.4 million people that sustain TBI each year. See, so think about a million people. It's too bad. With not a whole lot of resources, by the way. Not a whole lot of resources. Not a lot of people with resources. I do want to touch on this. I made this one super small on purpose because really all the different symptoms aren't relevant. But it's mild TBI. We call it the misdiagnosis. It's something that we all need to be concerned about. I'll paint when I was typing up this slide. A patient that I see on a regular basis came to mind. This young man is a BMX racer. You know, these guys, they start off on a little track like this, well lined up, and they go down the thing, and they hit the berm, they're pedaling away. I've seen videos, actually on YouTube. I've seen video of him going over, face planting. This young man has sustained eight mild TBIs. They call them mild TBIs because he goes to the emergency room, and they say, your MRI is normal. Any loss of consciousness? No. Headaches? Well, a little bit of a headache. Any nausea, vomiting, dizziness, those are the symptoms. So well, you probably had a mild TBI. So after 8 different times of this happening, he comes in. I just highlighted the symptoms that he reported. Increase in frustration and irritability. Difficulty saying the right words. He was slurring a little bit. Spacing out. More rude, socially inappropriate. Lack of flexibility. Difficulty understanding others. Being fidgety. Emotional difficulties. And you know what his primary concern is, and the culmination of all this? Relating to people. He's having a hard time maintaining friendships. Because he says, I talk and it don't make sense. People walk away. I space out, and people really don't care what I have to say. So he's a prime example of why social skills are super important, especially for the misdiagnosis of the mild TBI. So that 1.4 million, I bet you that is a gross underestimate. But especially in the days of, you guys know the X Games and all these other, the guys are doing now backflips on snowmobiles. Y'all see this? They do double backflips on motorcycles now. The BMXing and the skateboarding, it's all about how much air can you get. A lot of injuries. A lot of these kids nowadays, no helmets. Any comments on that? And really today I want today to be about interventions and what we can do about it. Well, what are social skills? The list for what are social skills, I have 6 questions on there. So this is clearly not an exhaustive list. But starting and ending conversation, lots of children and adolescents with TBI, and how do I get in? It's like a post at the end of the day. You couldn't get in because you didn't know how to start a conversation. Staying on topic, I think with a patient that I was seeing was reporting difficulty even focusing. So how do you stay on the topic if you have difficulty focusing? For kids, turn-taking, eye contact in our society is very important. Eye contact varies from society to society, culture to culture. In our society, you maintain eye contact, you look down for a second, and you bring eye contact back. And so it's important to teach those skills. Using gestures, you can see I'm up here with my hands, that's, the nonverbals are really important. Tone of voice, lots of teens, adolescents and teens that experience a TBI, even a mild TBI, it turns into a monotone, more of a robotic voice. So we have to teach them the intonation of it. There needs to be a little bit more tone and a little bit more variance with your voice. Nonverbal is facial expressions. Then obviously when I started, I said the importance of listening skills. A lot of the patients that I see in my 12 social skills groups, a lot of them are good at talking. Not too good at listening, especially some, I have an ADHD group, Monday nights, 5 o'clock, with about 9, 8-year-olds in there. I end my day right after that and grab home. Woo! Good kids though, a lot of listening and settling skills in that group.
what defines social success? Even before I get into this, I'd be remiss if I didn't talk about, you guys know the inverted U, the bell-shaped curve for intelligence, kind of goes like this. And for the majority of people, if you give them a psychological intelligence test, they're going to fall between like 90 and 110, the average is 100. So someone who has an IQ of 70 from an expectation standpoint, even with intervention, we're not going to expect their IQ to come to 110. So getting back to crystal clear goals and what our expectations are, and relating this inverted U, there's many psychologists refer to what's called social intelligence, which is the exact same inverted U. So an individual who's on this side, the 110, 115 side, we can improve that. Maybe to a 120 or a 130, just using that example. If someone comes in with very, very few social skills, we have to be clear as to what our expectations are. But these are some things that can go on the list, some skills that I like to teach, regardless of where you fall on that social IQ. Smiling often. They do research that if a random person approaches two people, one person smiling, one person has a frumpy look on their face, that person's going to gravitate to the one who's smiling. Smiling welcomes people in. Very important skill that I teach people in my groups. Remembering names. Also in the groups that I facilitate, even for kids that really struggle with remembering names, I make them do it. But there is an interesting story of my former business partner at Psychological Life Skills and I would go into a bank. I'm not going to say the name because I don't want to badmouth the Bank of America. But it's a true story that after being with them for 3 or 4 years, he and I would take turns going to the bank on Fridays. They wouldn't remember our names. It sends a message. And I know they're a big business, and maybe I shouldn't have lofty expectations on my part, but I think it sends a message. And if you meet someone regularly, and you converse with them, and the next time you see them, like, who are you again? The message is sent. What they had to say is not important. Who they are is not important. It's huge to me. Being able to initiate and maintain conversations, we talked about that earlier. This one I put in there for my mom. My mom's old school. Neat appearance and hygiene. Huge. They asked her, you need to look all nice, Chrissy. She asked me what I was wearing today. I said, Mom, I'm wearing a suit and tie. Is that fine? I almost never wear ties. I always wear short sleeve shirts and whatnot. But it makes it, if I show up here in my flip-flops and my torn jeans and a tank top, it sends a message. And having a neat appearance, a lot of the kids that I see, including TBI kids, if you show up to school in elementary school with bad head, that may fly. Right? If you show up to school in middle school with bad head, you put the bullseye on your back because the kids are going to be coming at you. Back in the day, floods, remember floods where your parents were elementary school, if your parents didn't buy you the jeans that year, that would fly. Middle school, crushed. You're getting crushed. And that goes true of deodorant, it's true of bad breath, everything. I encourage all middle school and high school students, shower in the morning. If you have to wake up early, you have to wake up early. Your appearance says a lot. And maybe that's superficial, and maybe that's judging a book by its cover. This is society. This is the way people operate. There was you probably noticed some study that was done that people form an opinion on you within the first 5 seconds that they meet you. That's appearance-based. I don't want to minimize it. Also able to problem solve. A lot of kids that struggle socially respond without thinking. Resilience is really big. A good example is I had a high school patient who asked a girl out to the prom, and when he was rejected, he was in his room for months and months and months. So we're looking for is resilience, bouncing back, asking somebody else. And the other things are more, we'll talk about a little bit more as we go as far as meltdown kids, the 3 ingredients, 2 meltdowns, cognitive inflexibility, if you have tunnel vision, low frustration tolerance, meaning you don't deal well with frustrations, and you respond in an impulsive way, you possess those 3 ingredients, typically a meltdown child. And those that are socially successful, they are cognitively flexible. They can see off in the periphery, so I can respond this way or this way or this way. They're able to deal with frustrations and they don't respond impulsively. Comments? Let's keep going then. How can we help? This is, again, this is the meat of the presentation. I think that knowing a little bit about social skills is important, but the parents that bring the kid, bring in the children and adolescents, I see, they want solutions. They want to know, how do I deal with these issues? And that's what I want to share with you guys, to deal with the people that you work with on a daily basis. There are basically 4 possible alternatives. And it's not like you just have to pick one. There's individual techniques, or for me would be individual therapy, is meeting with a child or an adolescent for a one-on-one. Group techniques or group therapy, which that's my specialty area in my social skills center, where I facilitate my groups each week. I'm a huge believer when it comes to the groups that peer intervention is far more, I'll just give you my bias on this right now, peer intervention far more powerful than one-on-one intervention. Just to use the deodorant or a bad breath, a parent can tell a 14-year-old teen, put your deodorant on, brush your teeth, over and over. They can come see good old Dr. Haley. Dude, man, you gotta put your deodorant on. They don't change. All of a sudden, you get to school, and you sit next to a girl, and the girl comes over and says, you stink. Where's deodorant? What? It's on 6 times a day after that. Peer intervention, far more potent, far more powerful. That's why I'm a big fan of the group techniques or group intervention. Now the ABA, the Applied Behavior Analysis, you guys are familiar with this? This is really popular. My first master's degree, as Betsy said, from State University of New York at Brockport, was in behavior modification and applied behavior analysis. And behavior modification was huge back in the 80s. And it was almost like it was kind of losing its flair when I obtained my master's degree in ABA. And now with spectrum disorder and other diagnoses, it's come back and it's really popular. In my opinion, again, I'm biased, but in my opinion, the ABA is better for those with moderate to severe TBI, less so for mild TBI. And the ABA is best done in the home, typically, and done intensively, as in multiple hours a week, very costly. I don't think has anyone heard of insurance that pays for ABA? Do they pay for it?
My neighbor's a private ABA therapist and insurance they're starting.
That's good to know. Starting the problem. Good. That's the first time hearing of that.
Yeah.
Excellent. And the final way is parenting techniques, but please substitute that with professional techniques as well. And I'm going to touch on each of these as we go. The individual techniques, and again, for me, this would be more individual therapy, being in my office, one-on-one with the child. These are probably the best strategies for teaching social skills, and they're probably strategies that you guys can implement and use with the clients that you see. What structured feedback involves, and this used to be a great idea back in the day, when my recess back in school, I think, was 45 minutes. I know recess nowadays is, what do they get? 10 minutes, 15 minutes, whatever it is. But what structured feedback involves is an observation, sending the child or the patient out into the real world to interact with others, and then a feedback session. And this is something I developed a long time ago, and it really has positive results for social skills. And I'll break it down into, say you have 30 minutes, and I teach parents to do this on the playground. Go to a playground, sit down on the bench with your child, observe what's going on, and comment on it. You're commenting on the good, the bad, and the ugly. So you're looking for a positive interaction between kids, and you say, hey, did you notice that? That child went up to that child and introduced themselves, and now they're playing together. You're looking for a not-so-good situation where a child cuts another child in line at a swing or on the slide or something. And you point these different things out to the child over a 10-minute period. Then you say, all right, you go out, because obviously the kid's going to be anxious to get out there. And you send your child out, and then you sit back and you observe how they do for 10 minutes. Parents even take notes when they do this, to jot down all the different things that the child does. And then after 10 minutes, you call the child back and you give them what they did. This is what you did well. This is what you need to improve on. And just like when you have a teacher conference, the teacher always starts off with the good, then goes to what they need to improve, and they end with something good. I recommend that parents do that with their children. But it's direct observation. I go off on tangents all the time. I'm all about real life, and I'm less about cookie cutter structured models. We'll talk about this when I talk about my groups. And I like real life things. That's a real life thing that you can do where kids actually sit and watch what other kids do, and you learn from both of them. Has anyone ever tried that before? It's effective. You can actually have teachers. Encourage teachers to do that every semester. But it gets harder because the periods are shorter. From a social skills perspective, recess and lunch are the two most important periods of the day. That's where really social skills are made or lost. Another one-on-one technique, videotaped interactions. I actually used this for a child that was going to school and didn't have the best eating habits. And so would eat with their mouth open, would be all over the place, and their whole little area would be messy. So what wound up happening is no one wanted to sit next to that kid. So what I did was I had the parents pull out their little phone with the child's permission. You wouldn't want to do it behind the child's back. Videotape it and play it back for the kid to see, to say, this is what you look like. Not to shame, not to embarrass, but to say, hey, this is what other people see when they're sitting next to you. And that was very powerful. Then the child was able to gain some insight and actually make some behavioral changes because of it. Still not great with it. Still not great, but better. The TV shows are really good for, you want to find a TV show that is, kids watch this, it's for musicians, a TV show like Victorious or something that has overacting. Fresh Meat Band, that's what I just thought. Anyone ever see Fresh Meat Band? This is for musicians. They overact. So you can teach social relationships by having kids watch this and say, what do you think is going to happen next? So for example, there's an argument between, and there's some overacting going on, you really play it and say, what do you think is happening here? So you pause the TV show and say, how is this going to turn out? Or what do you think how do you think this is going to end up? Kids respond to it positively because they like the TV shows. You just want to screen those TV shows in advance and pick ones where it's going to really pull for whatever it is that you want to work on, whether that be conflict resolution or positive relations, anything. You can use it for anything. Modeling is a great technique. It's basically you do what I do. And that I'm going to model appropriate positive social interactions in my everyday life. I'm going to share with you when I'm doing it, and I want you to follow that in kind. Obviously, kids learn a lot from parenting and modeling, so I think that will be a good tradition. So in everyday interactions, in everyday life. I know you're all familiar with role playing. I have done this in the past. I am not a fan, and I'll tell you my story. When I first started teaching social skills in an individual format, this is actually my doctoral training, like in the mid-90s. The professor, my supervisor says, okay, you're going to teach this as a 6-year-old. You're going to get on your knees, you're going to lay on the ground, and you're going to pretend to be another 6-year-old, and you're going to come up with different situations, and you're going to role play it with the child. I say, no problem, that's what you want me to do, that's what you want me to do. So his name is Billy, cute kid. So I'm on the ground, and I'm like, okay, I want you to pretend I'm 6-year-old so-and-so. He goes, but you're an adult. I say, but no, just pretend I'm a 6-year-old. You're an adult. So I like real life, that's why the group can interact with your peers. That's why I didn't have a whole lot of success with that. A lot of people have though. Positive reinforcement, I'm all about reinforcing the good. We're going to talk about that later. Behavior change, and this gets back to my days of behavior modification. A lot greater behavior change from focusing on the good, catching being good, as opposed to the negative. You guys are all familiar with that. Has anyone heard of social stories? This is Carol Graves has developed these. Here's an example of one. This is a technique that, again, for a mild TBI, I wouldn't recommend it. I don't even know if I recommend it. It all depends on the level of functioning of the child and adolescent. It is very simplistic, and it is something that requires real life experience and practice to become proficient at. This is an example of a social story that I pulled off the internet. When someone is hurting or annoying me, I will. It's a very concrete, and you want to make it as simple as possible. Look at them, put my hand up in a stop sign, say to the person, stop it, I don't like it. If that doesn't work, go get help. That's great to learn the basic concepts. In real life, you want to do in vivo, real life practice over and over and over again. With the social stories. The social stories are not enough. They're a great starting point. Typically, in my social skills center, I don't see children and adolescents with moderate to severe TBI. And if I do, in one of my process social skills groups, I'll just have a dyad, just a twosome, or at most 3. And we can start off with things like this, but I like when you do it back and forth, practice back and forth with each other. It's more effective. Those are some individual strategies that you can do in a one-on-one. This is what I like to do right here. As I said, the majority of my week is spent doing social skills groups with children, adolescents, and adults, as I said. Big buck. The vast majority, as in everyone in the United States, except for one other person, it's a true story, does what's called structured groups. What structured groups involved are, and you guys may be familiar with these, a structured group is a time-limited group that has an 8-session model, a 10-session model, a 12-session model, where week 1 you focus on this, maybe eye contact. Week 2 you focus on this, how do you introduce yourself to someone. Week 3 you focus on this, how do you do a conflict resolution. Where after 12 weeks, then apparently you gain all these skills. I don't like it, and I don't do it that way. Any Seinfeld fans out there? You don't like Seinfeld? All right, I got a good story for you. Remember Aaron, the close talker? Judge Reinhold? Remember him? This is a guy. There's a guy in Seinfeld, for those of you that don't know. Judge Reinhold, is that right? He was a really social guy. He made friends with the Seinfelds and the parents. But he had one issue. He was what they called a close talker. So that he would get right in, hey, Mr. Seinfeld, how you doing? I'm one of these guys. My theory on that guy is he participated in one of these structured groups, but he must have been sick the week that they did personal space, right? That's my thing. Because he was very good socially, he had good eye contact, he carried on camera, he just right in people's faces. The structured groups are okay. But when I first started doing the groups in '99, I started with the structured groups because that's all that was out there. That's what the research said to do. But all my groups are after school, because I don't like pulling kids from school. And these are kids that for 7 hours a day were in an educational setting. And then you come to Dr. Haley's office, and for another hour you get educated. And they were too loud. It wasn't real life. It wasn't fun. It was very educationally based. So after trying that for a little while, I moved on to what I do, which are process groups. And you guys probably are familiar with process groups. Process groups were really developed by a psychiatrist back in the day named Yalom. But process groups push for interactions amongst the group members about whatever is going on in the moment. The name of my groups are peer process social skills groups. I never go into a group with a plan, never. I go in and I say, hey, what's going on? And even my ADHD kids, all of a sudden kids will start jumping in with this or with that, issues that they've had at school, problems that they had with the parent, a difficulty with the sibling. And we process these concerns right there in the moment. We come up with strategies and solutions to help whoever that group member is. And in addition to that, I use what's called my incidental teaching approach. You guys may have heard of this before, which is you intervene in the moment when the situation, the feeling, the behavior, whatever's going on, whenever it calls for an intervention, you jump in. So if I have a child who, I keep using eye contact as an example, I'll stick with that. If I have a child who's talking with his eyes down, I'll jump in and very positively, hey, don't forget about my group. And have that child look up. If I have someone who's not talking at all, some kids in the group are a little bit more passive, and I'll turn to them and say, hey, Julie, do you have anything that you want to add to that? Or is there a topic that you'd like to get brought up? So in any 1 hour, rather than teaching the one skill, which again is structured group, teach multiple different skills depending on what's going on with each particular child. Now, the hard part about that is you need to know what's going on real well with each and every one of the kids that are participating in your group. You need to know what the strengths are, or what areas they need to improve on. Now, some kids, my ADHD group, they do a lot of talking. So the goal there is to practice their listening skills. Some kids are a little aggressive in their play. A lot of my groups will do fun stuff. Working on that. So it's joking it in the moment when the situation calls for it. And that, in a nutshell, I mean, I do hours of presentations, like 3-hour presentations on my process groups and the specifics behind it. If you go to my website, which is listed on there, my book, and I have a DVD, which I'll tell you about in a second, they're on there for free. I don't charge for it. You can download it, set up a username, and you pull up my IT edit. I don't know how you do it. You pull it right off the internet. And the reason I have a DVD is because back in my grad training, my master's degree, my doctoral training, I would read these books by these therapists, these well-known therapists. You know, this is how you do this, or this is how you help with depression, or this is how you do that. Now we step back and we wonder, okay, that's cool, I get the technique, but what do you really do? What do you really do in the office behind the door? That's what I always wondered. And so to demystify what I do, I actually filmed 13 vignettes of different situations or scenarios that come up in my social skills group so you can see me firsthand. Actually, you guys know the Pied Piper Theater in Manassas? You know the Pied Piper Theater? Actually, I get a whole bunch of actors from there to come in and you'll carry out different situations that come up in the group. It's awesome. Yeah, they're great kids. Great kids, yeah. But yeah, if you want, it's free. It's on the website. And you can see exactly what I do. A little bit on the ABA, which I personally don't do as much anymore. Again, this is more for the intensive in-home behavior modification stuff. The American Psychological Association really loves ABA because it's an empirically validated approach. It has been researched and researched and researched and proven to be effective. The key to ABA is almost like an IEP. You want to be very specific. You want to make it individualized. So this means a comprehensive evaluation. You want it to be objectively defined goals. But one of my problems with ABA is it's very much like an IEP in that the goal is listed for the patient will give you a handshake appropriately 80% of the time. And unless there's like a scientist, I don't know, sitting with a clipboard documenting each and every interaction, I don't know how you actually can do that. You guys know IEPs? You ever read these IEPs? How do you measure that? I mean, how does someone sit there? I think the people do the best they can with it, but it's hard. It's hard to do that. You all know we live in a very independence-based society, so the program has got to be your activities of daily living. It's got to be, you need to be able to be independent. And it's got to focus on multiple different areas of life. So we all have a home life, an academic, or for us that would be a work life, and your social life. And for ABA to be effective, it's got to be across the board. It is not enough just to teach parents ABA. It's not enough just to help have a teacher implement the ABA. It's got to be across the board in all these different spheres. And finally, I say again and again, use of positive reinforcement. Always catching the child being good and reinforcing for it, rather than punishing the bad. We're going to get there in a second, too. That's my brief spiel on ABA. Do you guys know the principles behind this? There's like shaping and extinction. I don't know the specifics of it. You can pick it up on the internet. It's effective. More moderate to severe TBI. I would start with the ABA. It all depending on this one. Comments? and parenting. As I said, I wasn't quite sure who the audience was going to be, but parenting, you can substitute it with being a professional too. When you bring a child in the world, your overall goal is happiness and health, and that's what I'm pushing for here. Really funny story. I was at a parent meeting